women spend 25% more of their lives in poor health compared to men. Welcome to the Women's Health Uncovered podcast. I am your host, Mariam Harutyunyan, and together we will uncover the path to better women's health. This podcast is brought to you by the Kinarmat Initiative. We bring together different stakeholders to tackle society's most pressing challenges. And I also want to thank our partner, FTI Consulting, for believing in my vision and mission and making this podcast a reality. In this podcast, I'm bringing together the voices shaping the future of women's health to spark dialogue, share game-changing insights, and uncover solutions for a more equitable healthcare system. Get ready to learn things about women's health you've never heard before. Don't miss an episode. Subscribe to our podcast on your preferred listening platform. In this episode, we take a closer look at the state of women's health, what progress is being made, what still needs urgent attention, and where the biggest opportunities are for change. It's time to uncover the path to better women's health. Joining me for this conversation are three remarkable guests. And to start things off, I have a question for all of you, but it only requires a one-word answer. Are we ready? Stine Bosse, welcome.
Thank you.
You are a member of the European Parliament, a key voice in European policy advocating for gender equality, and you had an interesting journey before joining the Parliament. With 30 years of experience in business, I think we can tell you a seasoned executive, having spent a decade as CEO of a Nordic insurance agency and 14 years as a professional board member. If that was not impressive enough, if I may add, an interesting fact, in 2010, the Financial Times named you one of the most influential businesswomen in the world. Welcome.
Thank you so much.
I have one question for you. If you could change one policy related to women's health, what would it focus on? I know it's tricky, but one word.
It would focus on research.
Thank you. My next guest is Isabelle De Walsche. You are managing director at Richter Pharmaceuticals. With over 30 years of experience in the pharmaceutical industry, you have built a Benelux affiliate of Richter Pharma from scratch, actually, 13 years ago. And you are still deeply passionate about healthcare and people, I may assume.
Absolutely.
Welcome.
Thank you.
I have also a question for you. What's the most urgent need in women's healthcare? One word.
One word. The most urgent need. Listening.
Listening.
Yes.
Thank you. And my third guest of today, Sarah Ahannach. You are a microbiologist and postdoctoral researcher at the Department of Bioscience Engineering at the University of Antwerp. You're also the co-founder and project manager of the groundbreaking Isala project, which I was really happy to see when you launched that one. And that's not all. You're also the research manager at the newly established Center of Excellence, Umami. Welcome, Sarah.
Thank you.
One word answer. What's the biggest barrier to women's health today? I know.
That's a difficult.
There are many barriers. The one that it's on top of mind.
I think inclusivity.
Inclusivity. Yes, thank you. I would love to deep dive into that a bit later as well. And a fun fact, Sarah and I actually studied together biomedical sciences at KU Leuven. So it's a pleasure. Yeah, we go way back. And you know what's fascinating? Recently, I was reading this study on the brain, where I discovered that women's brain looks differently than a man's brain, actually. And this long-standing idea that except the reproductive organs, we are just a copy-paste of the male body is not true. And I think there is more awareness around that. But then I was reading, apparently, women's brains are typically 10% smaller than a men's, but compensate with denser neuron packing. So just to say there is this huge difference. And when I was reading it, I was like, wait, what? Nobody taught me this? I studied science. How is that even possible? Did you have this kind of moment too, where you read something, saw something where you were like, wait, what?
I can try.
Sure.
I mean, and this goes a few years back, but I learned that the risk for women suffering from heart failure and with a deadly outcome was, I can't remember the percentage, but it's quite significant higher than males because there was so little research, and some of the symptoms that should warn you were not known. They could be very, very different. And that's the first time I thought, wow, something's wrong.
Yeah, there is actually, I think heart disease is the leading cause in for women's death, actually. And sometimes women are being sent home with the symptoms of a heart infarct just because we don't know the symptoms very well. Isabelle, did you have also such a moment where you were like, what?
Well, it's a bit in the same line, but it takes a bit further. In fact, I read that in the beginning, when there were all or mostly male included in clinical trials, the side effects were apparent in 85% of the women, so much higher than in men, because they have a different way of, distribution in their body. And processing it. And then I thought, something is wrong, we should look at it differently and at least on an equal basis.
Yeah, definitely. And then Sarah, you are a scientist, but I'm sure whatever conference you've been to, a paper you've read, you were like, I have never known this.
I feel like I learn every day, which is what I love about working at the university. I think mine is more related to my field. So I've been learning about that we have microorganisms in our gut, and they're important for digesting our food. And I just discovered just by joining the group that there are also microorganisms in our vagina, and they're important for vaginal. They help us prevent vaginal infections, and they help us in fertility and pregnancy. And it felt something so important, and I never heard of it. I just didn't know. And I was like, oh, and there are like billions of them.
Yeah, but now you're researching it.
Yeah,
so I'm really curious about your research, actually. If you could share a little bit more about, because you've been at the forefront of studying the female microbiome, an area that has long been overlooked in medical science. Could you tell us a little bit more about what's the key focus, what are the findings, what you're doing?
Okay, I'll keep it short because, scientists can go on forever. So I work at the lab of applied microbiology and biotechnology. And what is unique about our lab is that we focus on healthy bacteria, beneficial bacteria, and see how they can help us in life and all kinds of fields. And one of them is actually in women's health. So I focus on studying the vaginal microbiome in a community-based approach. So we set up the Isabelle project that you mentioned before. It's a citizen-sized project to study the vaginal microbiome, not just in women who have an issue, but just in general, just to know what is healthy, because to understand disease, you need to define and understand health first. It doesn't make sense you need to know how you can get from one condition to another. And we set up the Isabelle project, and we were looking for 200 women to just take a vaginal sample at home, just random women. And everybody was saying like, ugh, women would not want to do that. It seems like something that women would not want to do. And then we launched in 2020 because we thought, maybe we're crazy scientists and we like our own research and nobody else.
Yeah, but no, you had a great response.
Yeah, so within 10 days, we had 6,000 registrations.
Wow. Yeah. And you only wanted 200, so that was great.
So we didn't have the money.
Next problem.
But we were so happy. And I thought, at first it was, during the pandemic, and I thought maybe women didn't have much to do, but we got so many messages and women were saying like, finally a project about us, finally. The finally was something that felt like an unmet societal need. So now we're actually continuing to study it, continuing on our results, expanding worldwide. We're almost in 20 countries studying the vaginal microbiome. So that's really in short.
Yeah. But where do you think the knowledge gaps lie in understanding the female microbiome?
So first about which bacteria are there and what they do actually and how they're linked to all kinds of aspects. We often see, and that's a lot we see in women's health, to see everything separately. This is a heart, this is a brain, this is a skin, this is a vagina. It's all separate. That's the way I've studied. This was the gastrointestinal system. You had the reproductive system, but it all is interlinked. It's all interlinked. If you have a breast cancer treatment, there is an impact on your vaginal microbiome. It's all things that are not being taken into account. So I think that's one of the biggest gaps. Is not only we need to deep dive into our own field. I'm a microbiologist, but we need a more multidisciplinary, holistic approach to women. And
it's funny when you're saying this because we actually sense it. I mean, if you're just a little bit aware of what's going on in your body, you actually well know that, it's connected. And then just one funny thing that occurs to me when you talk about this sort of the biology of the vagina. I was always taught and experienced that it works. If you have a kind of, irritation or something, use yogurt. Simple things. But that connects very well to what you're saying.
Yeah. A lot of women are telling us as well. It's
wow.
It's actually has a small scientific meaning because in yogurt you have bacteria. And there are, it's Streptococcus thermophilus, but also lactobacilli. Yeah. And in the vagina, you also have lactobacilli. They're not exactly the same, of course, but they exert some of the same capacities. So if you go to the more probiotic industry, like the cleaned version of yogurt, then they do apply. So actually, if we compare to the dairy research, can overlap sometimes the interesting findings, and we learn from each other. But the yogurt story I heard as well. Yeah, and some women are sharing that. So there is a woman who, it's just a fun fact, she takes a vaginal sample and tries to make her own yogurt. Because
okay, that's a bit more.
A lot of things.
It's very, very interesting. Yeah. But I'm also interested about how these findings in research translate into real-world healthcare solutions. Because Richter Pharmaceuticals specializes in gynecological innovations, a field that has been historically overlooked as well. Yes. What are the shifts that you're seeing in the pharmaceutical industry when it comes to women's health?
Well, of course, I have a bit of a privileged perspective, so to speak, because we focus on women's health. So if you do research on contraception, it's obvious that women are included in those studies. Yeah. But even that left out of sight, I mean, if we look today, there's a lot more attention on topics that were a lot of taboo in the previous decades and even years, like fertility issues. Yeah. And then they focused first on women, but men were out of the scope. No, very often it's a problem of both in the couple. Menopause, huge taboo. They were all hysterical women, having issues, and they just should deal with it. Yeah. And even worse, even fibroids, heavy bleeding. It just was part of life. Your mom had it, so you deal with it. You live with it. It's normal.
You have menstrual pain that comes with it without knowing where the pain comes from.
I talked to some women that suffered from it. They were never recognized because they were told it's normal, and they were crying and crying because it had a huge impact. They couldn't go out of the house wearing anything, afraid of, making stains on a anything they would sit on it's horrible. Yeah. And so we have to listen. That's why I said listen to women and take it for serious what they are saying. Yeah. But there's a shift. I mean, we are coming from far.
Because there are some things, especially when you also see in the media, there are some trends happening. For example, menopause is also receiving some kind of attention. Endometriose, finally. Like, what are the trends you're seeing that are coming up?
Yes, it's a bit weird to say, but okay, menopause is hot. Finally, there's a lot of attention because also they see that women work more than before. They're not at home. They have active careers. What's the impact on the work floor? Is it that severe that they should do something about it? It's not a disease. It's a part of life.
Yeah.
So that's also something important for me. It's part of life. Menopause is not a disease. And we should approach it as such, but help these women to go through it in optimal conditions. And that is very much of what you were saying, have a holistic approach in that. And that is also a shift, I think, that we are looking more and more, luckily, at the whole thing. What can you do lifestyle-wise? What can you do with treatment?
Yeah, because it's not just about well-being. It really affects your economic participation, social participation. Absolutely. So it's really broader than that.
Absolutely.
And what I wonder is, how does, or what's actually the role of policy in shaping healthcare priorities? There are some trends, there is some movement happening, but in shaping the priorities, what is the role of policy and, at the EU institutions, for example, what are you addressing? Stine?
I think, first of all, it's very necessary to say conversations like this has to be much more. I mean, we need knowledge to get out there. And I also think that sometimes we as politicians have to hesitate a bit about, we just make a new rule, because I'm not always sure that's the solution. Sometimes it is, and I'll come back to that, but sometimes we also have to say, this is about knowledge. This is about listening. This is about making sure that the market, I mean, it's 50% of the population in any country in the European Union, would be female. And there has to be a listening into our special needs, and there must be a business case. I mean, otherwise people just cannot calculate. So there's a lot to do in just speaking up about these issues. I wanted to say also, my daughter suffers from this endometriosis. It's 10% of the female population. It's many young girls, and there's not a lot of research.
No,
some, but it's not enough. So speaking up, making sure that this is on the agenda in many areas. Then I wanted also to say, and everybody doesn't need to agree on everything, but for me, and this is very strange, I'm 64, and I would never have thought that I would have to be vocal on female reproductive rights, but we have to.
Yeah, you think it would be already solved, or we take it for granted.
We did that. We obviously are in a situation where we need to talk about that again. And I want to make sure that everybody understands that the fact of having an abortion, let's call it also that, is not a question of having it or not. If you are in dire straits, you will have an abortion. My grandma had, her sister had, my mother had, and I know all their stories. And it was not because they thought it was interesting, if you know what I mean.
Yes. Yeah.
They were in dire straits. So they had, and it happened under horrible conditions. So that has to be, unfortunately, also part of what we talk about. And then, of course, all the areas that you touched upon needs to be definitely talked about. Then I think when it comes to regulation, to make sure that we encourage in cross-border trials, in the whole system of trials, that there has to be a gender balance. It has to be gone the times where we said, oh, it's too complicated with women because they have this, cycle. No. We are 50%, and as you can talk into this, but as I understand it from you, it is actually an important knowledge, because there might be difference. If you just had your period or you're approaching your period, you are in two different situations, and that has an impact on what treatments you would be, reacting to. So for me, that's a whole lot of knowledge, and it's few new rules.
Yeah, but what are then, because recently you also lead the MEPs for Women's Health group.
Yeah.
What are priorities there? What do you want to achieve with that?
We want to achieve exactly this.
Yeah.
First of all, that we keep up the debates regarding, women's
awareness
rights,
around the topic. Yeah.
Second, that we talk into, that we encourage also in nations. In Denmark, it is happening. One of my political colleagues, she is also engaging in this, so that we raise awareness, and we make sure that there is a market thinking, a demand. We need this, and I'm sure that this will be picked up. I have to trust that, because I'm a strong believer in markets. And then, of course, in the areas where we can see that some of our regulation suffers from the fact that this we have not seen, we have not realized, there, of course, we should also talk about adding to the regulation.
Yeah, and then what I'm really curious about on that side, because we've discussed, okay, there is a lack, or there are not enough women included, and we want to do is make women more vocal and spread awareness around these topics. But let's just go back and at the first steps. Why is it like that? Why do we have not enough? I think it's for some of us straightforward why, but I really want to name it here as well. Why is it that we do not have enough women in clinical trials, that there is not enough research done about the female's body, and that our research is still male-centric? Why is that? Why has this exclusion persisted so long?
Well, you can go back to one example that a lot of people use is in the 70s when women took to the streets of Boston. They brought out also this book, Women and Their Bodies. And they were actually actually going for more research and talking about abortion, about even capitalism, all kinds of topics where women are excluded. And sometimes I look back and I think, we can just do the same tomorrow. We can just have the same march, the same topics. Yeah. But then, of course, we are standing on the shoulders of greats, and a lot of things have changed already. Just a few years, 10 years ago, women, when they were testing crashing cars, that the women were seated not in the driver's seats, and then they didn't even include pregnant women and so on. Yeah. So but I think the course starts with who's asking the research questions. So as a researcher, we have a new project, there's new funding, or there's just an idea. So we are sitting at the table, we have a drawing board, but then it means who is drawing on that board. If the team is not diverse, if you don't have a woman in your team, who's going to think about having a uterus and your period? So it's just the perspectives that are sitting at the table is already making it. So, and then even if you have women, they're not going to represent all the voices, because you can have a team, like I said, they have a team of 10 women, and you're not going to include everyone who had an abortion, who had a PCOS, who has endometriosis. You will never be able to include everyone. So that's why I think first, acknowledging that we don't have all the perspectives, then go look for them. You can do qualitative research. You can reach out to the public who have all this experience, and that's more community-based research, and then solidify it in a research question. Because what we have is sometimes we focus on a topic, and then there's only a small percent of people that are suffering, and then you have 10% of women suffering from endometriosis, and they're waiting 10 years for a diagnosis. Yeah. And then that doesn't make sense. So it's also, I think it starts with the diverse research teams that are asking the questions. Yeah. Yeah. And then I think it's also not seeing women as a monolith. They're not all the same. We cannot say we want to reach all women. They're so different. Yeah. They can be structured in socioeconomic status. They can be structured in education, in geography. Yeah. It's not the same. And I would love to hear a bit later also. Go. I would love to hear a bit later also on how you approach that, because you did approach that in your research as well. Yeah, that's when after we realized as well, because sometimes we also just learn from doing. Yeah. And it's just because a lot of research, especially in the States, they do a lot of associations or links or correlations with race. And then they have this classic white, black, Hispanic, Asian, and that's it. And then it's all associated. And then you say this group suffers more from this aspect. But then now, finally, we're waking up a bit more, realizing that that's more of a social construct. And if we look further, it's maybe the socioeconomic status. Yeah. That particular people of a particular group just live in an area. There is not a lot of preventive care. They don't have access. Has nothing to do with where they're from. So I think that is also not seeing women as all the same, understanding who you want to reach, and then understand, and then don't see them as a passive subject. They have an equal say. They can give ideas, or just there, because women are not looking for that. We have a lot of things to say. So just saying I'm going to study you, I don't think that doesn't work. We've noticed it.
But then you realize, because you're focusing on research, specifically women. So you actually need only women for your study. And then you launched this. First of all, you had a lot of response. So there were a lot of people participating. But then again, even you had difficulties to include women from all layers of society, different socioeconomic backgrounds. And then you also tried to solve that. I'm really curious about what were the learnings there?
Yeah, so definitely we're all learning along the way. So we had our launch, we had a lot of women applying and being part of it. And then we did the study, and then we realized before we come out with our conclusions, you need to be, as a researcher, have integrity, and it's going to have a big effect. You don't want any policies just following that without us properly researching it. So then we said, let's set up a demographic profile of the participants so that we can say like what we found is particular for this type of woman. Not everyone is the same. And then we saw that mostly white women, well-educated, would participate in these studies. Also because we didn't have so much funding to do a lot of outreach. We just did it on social media and press and who is on those platforms.
It's not
and also,
representative.
it's a little bit of bias. If I want to get pregnant, and maybe I want to like get my vagina checked, you know? But why not? So when we realized that, we said, okay, we're going to continue anyways researching. Let's first see how we can reach these groups. So we have identified the groups, so women of different ethnic backgrounds, but also women living in poverty. And we had focus groups, in-depth interviews with these women, and they all have different needs. Whether it is just a question, if you live in poverty, why would you voluntarily participate in research? You have so many things dealing with on your mind.
Priorities.
Yeah, so you would realize that you as a researcher needs to take away all these boundaries. And that's something that we are realizing along the way by talking to these women, actually them giving us advice. Also, for example, and you see this in a lot of countries with different political statuses also, is the trust relationship. Should I just trust a scientist? There's a lot of history where scientists maybe shouldn't have been trusted the same as Who do they see as a trust person? Is it maybe a GP, a pharmacist, just a community healthcare worker? So we're trying to identify all these points.
So you need an intermediate person to
maybe
bring them closer to your research.
Indeed, stuff like that. Other things is sometimes we have a perspective that particular groups have more taboo than we think, and then you realize that it's not the case. Then it's just
It's a prejudice.
Just because we haven't,
Interesting.
we haven't included them in the conversation yet to hear it from them, we just assume what might be a taboo in a community.
Yeah, so definitely. I forgot the question, sorry.
How you approached it.
So that's how we approach it. By really having conversations, actually.
It's actually interesting to see that there is a totally different approach and that you might have to take more steps, be more active in your research. It's not just publishing out there or posting out there that you need women to participate in your research, but it's going after and looking in the right communities. Is that something you have also taken into consideration, or do you see that also when you bring something to the market that it's different and that you have to take extra measures?
Well, what we see, I'm not in the research part, but what we see in clinical trials, for instance, is what Sarah just pointed out, is that the economic background is playing a huge role, first of all, to recruit those people, but then especially to keep them in the study. Because the compliance, that's generally know that in people that are in less favorable socioeconomic situation are less compliant because they have other stress factors in their lives. And it's not like the first thing they think about is to, be compliant every day. And so there's a lot of dropouts there also. So you have to consider all that. And that's then only women-focused study. But if we take it broader from what you said before, I think the gender equality and inclusion should be more focused because it's complex. As you mentioned, we have cycles. And through a cycle, we have a lot of different hormones working, and this has an impact. So it's more complex to take women into consideration. They exclude pregnant women, they exclude women in reproductive age because there's high risk. It's also an ethical thing, but then you have to see that you take the right measures to prevent maybe a pregnancy during that time or whatever, to at least be able to include them in the trials, I think.
It's not just because it's challenging that you have to exclude them. They're 50% of the population, whatever you bring out there. And it might also make it interesting, because they are 50% of the population.
Absolutely.
But this is where I think rules could be debated. To make sure that we not just encourage and not just hope for the market to realize, but that we also say now when you do the clinical trials, make sure that you have the right gender representation in the samples that you're studying, because I mean this has been going on for far too long. And I'm probably a bit more impatient than just waiting for all this to happen. So I think we should probably push in this
because
area.
if you leave it to just goodwill or whatever, it won't come. It's shown that it won't come unless there is some rules around it, etc. But then I'm curious, what are you institutions doing to tackle those inequalities and to ensure high standards in women's health?
I mean, first of all, the institutions need to get this up on the agenda. And now it is actually there.
Yeah.
You saw it the other day from Ribera. It's out. It's coming.
Yeah.
It's part of the so-called package when we talk about female rights and equalities and so on. So, and this wouldn't have been the case 5 years ago because nobody was really very well aware of this. So now it is in there. It's part of what we're going to deal with. So that's the beginning. And then we will see, this is the rules or the game for the parliament has to wait. Of course, we will push for it and we will ask for it and so on. But otherwise, we wait for the commission to come up with where are the areas where we can think about having rules. But here again, I want to push for this, but I also want to make sure that we have the conversations. I want to make sure that this is also a demand, because that's also important. That it's not just, we're waiting for the politicians to come up with these solutions. It has to be also, and I don't know what about, what's going on in all of Europe, but I can definitely say in my home country, it is definitely coming up on the agenda that this is an issue. Take the endometriosis. Nobody knew anything about this.
Yeah, that's true.
I was always very much aware of all these things, but this I never heard of until my daughter came and told me, I actually suffer from this. And I said, what? Mm-hmm. What is this? Mm-hmm. Never heard of it. Mm-hmm. And of course, now it is beginning to be spoken about, the situations for women, what are the solutions, and so on and so forth. So yes, I think the same goes for the menopause. As you say, it's going to be hot. That's because we are so many old people. But still active grown-up women who say, we don't want to just live with it. We want solutions. Yeah. And, they're out there, show them to us. And so, and again here, I have to say, and it is something that I really think about. Why is it that 50% is left out? If you take a market approach and you say 10% of 50% of a population, that's a lot of people, right?
Yeah, absolutely.
So if this was a pure male issue, I'm sure it would have been on the table.
Yeah.
And here we just have to say to the men, there's nothing wrong with you. Go on doing what you do. But we as female, we have to demand this. Yeah. We have to speak up. We have to talk about it. We have to say, this is an issue for us. We need solutions. And then I'm sure that they will be also suppliers who will say, oh, yes, of course. I mean, we need to get going.
We sometimes say as a joke, because nothing against men, of course, but if menopause would be a male condition, retirement would be at 50.
Oh, wow.
Yeah, and I really hope that more women even listen to this podcast, even just because to be vocal about something, you have to know, and not just because you were facing endometriosis, because you have it in the family, but just to know that these things exist. And it affects us. It's your body.
That's your taking for serious, that you're heard. Because all these women, before they get diagnosed, on average it's 7 years. It's huge.
Yeah, it's huge. 7 years indeed to diagnose endometriosis, and they suffer with it. And it's not because it's diagnosed that there is immediate treatment or that it's effective. So then there comes that, and it affects even your work, even your daily life. And sometimes you don't know it.
Yeah, indeed.
Yeah,
everything. So, but I also think for a woman, you have so much already, except just health, because there's all kinds of other fields where we can go on, and it's just a little bit too much sometimes. And then I feel like, to not put all of that of women, like women have to educate themselves, they have to advocate themselves, true. They have to look, they have to be, when they're sitting down with their clinician, they have to ask questions, but you just got some news and you need to process it. So it would be good if we, like as a society, take it on as like a shared responsibility, like all together we care for women's health, and it should be just a general policy for all of us to think about it. Because if it's always put on women, then it's like, it's a pink revolution. It's like women for women. And we like to say at our team, like, we all have to care about it, because otherwise nothing will get done. Of course, women will like lead the way, but if it's just like you have to learn, we have to all educate each other and increase the scientific literacy on each of these topics.
Don't misunderstand me on that one, because I don't think it's up to the individual woman But if we don't collectively speak up,
that's true.
Nothing happens. And so that's where we have to make sure that a lot of conversations are going on, and that you don't feel embarrassed or whatever if you are sitting with your doctor and the doctor doesn't understand you, and you say to the doctor, I'm sure you don't really understand me. You should be encouraged to speak up, and then the doctor will have to listen, your good word, because that's also in a survey somewhere I read, I think it's about 50% of women leaving a doctor with the sensation of, he didn't really, or she didn't really understand me. So that, of course, should be something that we should not experience.
And that is also evolving. There's more and more voices saying that, okay, it should be a shared decision-making process, whereas even 10 years before, the doctor decided. And now it's a conversation with the patient, whether that be man, child, or woman. Yeah. At least you have a word to say of what you want, what you're really feeling, and what feels like good for the right decision for you.
Yeah, more like a patient-centric approach.
Absolutely.
Sure. And here, I guess also social media, we always nowadays say that they are, difficult to deal with in many aspects. But here, I think actually they've done a lot of good. Because also people suffering from different situations find each other and say, okay, you also have had that experience, so I'm not alone. And that is actually
it's comforting also that they're not alone already.
There are a lot of groups on social media where they find each other and they structure themselves, and then become a non-profit, and before you know it, they're like
Well, there is, because a lot of people go and even online to find solutions or to find answers, even ChatGPT or whatever. How do we tackle that?
Sure.
That's a tough one.
It's a tough one.
Yeah, Dr. Google.
But look, I had to do this. My daughter, when she was 32, she suffered from a virus that went in her brain. I mean, could have been male or female, that's not the issue. But I had to use Google to actually get through to the doctors to say, this is the problem. They kept saying, we don't really know what happened, we don't really know what was that, until I found it, after 10 hours on Google. And from there, the process went better, but So thank you very much for that kind of possibility.
Then you also mentioned it's not a women's issue. That's true. How do we get men on board to care about the topic? Then there was silence.
I think it's an evolving thing also. The voting rights for women in Belgium. Not so long ago. That's what I tell my two girls. It's not a given. Women had to fight for it. I think it's the same. No, it's normal. It's normal that women can open a bank account on their own. It wasn't 50 or 60 years ago. So it's evolving to the point where it's a given. I mean, as you say, we are 50% of the population. So I think men are taking it more for naturally now already than the generation of my grandfather. When I started my career, he asked, and when will you do your household? And I laughed and I said, at night, So there's a mind shift already. And also in healthcare, we see a mind shift. There are much more women already involved in research, being a doctor, being in leading positions. So we are there. We are more present. I think that's
also exactly what you said in the beginning, where it's a question of not being able to have children, and where if this is identified in a couple, and even if it is mainly because of the quality of the man's sperm, then it's the woman who gets the treatment, right? And if we talk, men don't think about this. Honestly, they don't. But when you talk with men about it, and you say, did you know this was the case? What? So sometimes, again, it's about knowledge, and we don't speak up about these things. We just say, okay, that's fine, we'll do this and that. We have to talk into it. And then, of course, there must be much more research in why is this sperm an issue, and what can then be done with that instead of treating the woman with very hard treatments often.
With hormonal treatments.
It's speaking up. I think sometimes I just even see a difference with my mother's generation and mine, that were there for her it was very normal to I don't know, you have this issue, you just like stay humble and you keep it for yourself and you work through it and silent because that's a strong woman.
Yeah.
And now it's like, no, I have this issue and everybody should know I'm happy. And because if you don't share, you cannot blame in a way because you didn't know. So we also have to like, you cannot just imagine, you have this thing going on. You have to say it and we have to share it and it has to be a safe space. So it's definitely like a combination of all these things because eventually if you need numbers for a business case, you can, it will lead around and affect men as well. So, of course. So we can find them if needed.
I've heard also that during this conversation, the topic of funding and how that limits research even. And I'm interested in how funding, or let's talk about whether it's private or public, how that limitates the large-scale impactful studies.
Yeah, money is everything. So for us from research, it's if it's not a topic that is, because it is also in funding, there are hot topics and non-hot topics. Like during the pandemic, it was a hot topic. Money was free and everybody could get funding. And for women's health, if it's not put on the agenda, on the policy agenda, then there will not be grants available and even specific grants. Because that's how it all starts. You can make a study as large and as small as you want. Ideally, you want it large and you want it inclusive. But as we talked on before, if it needs to be inclusive, you need to put efforts. You cannot just do a call and then expect that everybody will join. So funding is really important, and it's necessary to really do thorough research, because otherwise we'll just focus on one field. But if it's about endometriosis, we need to see, what is actually this disease mechanism of pain? Like understand it and not just immediately go, because we have not enough funding, so we go immediately into treatment options. But because that's like when we have to write funding applications, we have to think about, what's the valorization potential, in what return in 5 or 10 years will it give? But if it's like such a small funding proposal, then you cannot do so much. But you really want to understand and want to do thorough research and still have your look in, what can be the impact. But some things are just not known. We've talked about endometriosis, but you also have PCOS, for example. That's even less research. Yeah, so I think it's for us, for me as a researcher, it makes or breaks something.
Yeah.
We try to do a lot of voluntarily research. If we don't have funding, we just do it on the side.
Yeah.
But yeah.
And then you also do citizen science. That's something that you really implement. That must be also expensive.
Yeah, at first we thought, it wouldn't be, but then you realize if you want to do science communication, because at the end, if you go through everything and you might have something on the market, but people don't understand what their bodies do, then it doesn't work. We need to be already educating, like for me then, what's a microbiome? What do they do? What do these microorganisms do? We need to take care of them. And citizen science helps in a way in not only communicating, but also giving back. So that's actually the concept is that citizens participate in research and even deliver research questions and are more active. And that's how I think we've come up with some stuff that we haven't thought of before at all.
Yeah. That's very important. What you mentioned is education and awareness. There's still so much work to do, because women, or any human body, I think, doesn't know half of what's going on in his body and in her body. So if we start there and start to recognize certain things, and the knowledge also of what can I do myself and how can it be treated, what are my options, it's a huge step forward.
I think on the financial side of this, I really think policymakers have a lot to do.
Okay, I'm glad to hear that. Tell us more.
Because I think, to get things going, because it would be still, I guess, for many investors reckoned sort of in the area of high risk, because what is this? We don't know enough about it. Are we sure? All these uncertainties. So here, of course, we should, as policymakers, also make sure that there is a kind of funding. I very much hope that we will, when we look into at least the MFF, but perhaps even before, that there will be sort of new thinking around having pools of funding available. I want it to be equity, but that's because I think it's a good idea that it's not just grants given out, but it's actually, with some kind of participation. So I think that is definitely needs to be on the table. And I also think, regarding funding, we have to make sure that we also, you talked about business cases, that is the way to make sure that it's talked to, that it's shown that this is also a market issue. And of course, that innovations have to be supported because and here to attract capital is not only a question of is it good research and so on, but also the way that we treat this capital. Now I'm jumping into the financial sector, but the way that the capital load needed for some of these investments should be looked at because it's too hard. And here we can actually do a lot as Europe because we don't want the money to go to the US. We need to keep it here to make sure that the investments actually stay here and that young people like yourself, Sarah, that you say, I want to stay in Europe, even if I know this time it is like this, but we have to change this, that it's easier to have access to capital in the US. That is a big issue. And that is one of the, for me, cornerstones in changing many of these patterns.
I like it that you have the business background because that gives you some innovative approaches to the problem. It's true. And I hear that it's an interesting mechanism. What do you think of that, Isabelle, or what I hear a mechanism, correct me if I'm wrong, if there is this risk of investing in it, what if the public sector would lower that risk by doing some initial investment and then have the private sector build up on it?
Yeah, I think the private sector is already building on it. What we miss, I think, is a bit of collaboration because if you look purely from the private sector, for instance, my company invests about little less than 10% in R&D. But there's a failure risk, right? So you can include X patients in a study. You don't know if the study will succeed, if the result or the medicine will ever be recognized. So that is then, to call it like that, money down to the drain. So this whole risk has to be calculated in. And I think, as you say it, if we could collaborate on this, it would make it much stronger and avoiding that we have research going elsewhere in the US or something else, and that we, join forces and make this happen in a much stronger way. I think that's the way forward. Yeah.
HERA is already working down some of the, as investors. And I think we need to see much more of this.
So it's not a one sector responsibility. It's not the role of only one stakeholder in this case. We have to all work together to make something happen. Do you see that as one of the biggest challenges, I would say, Isabelle, and how would we be able to work together?
Well, I don't have the crystal ball to say how. I think this is a good start that we talk and that we see, building bridges. That's what we do somehow also. I think there is a start that we have to see what are the options, what are the real needs for research, and how can we find each other in that, and finding priorities and making funds available for that, and involving local good researchers and make it happen here. I think that's the way to go.
Yeah, there are some initiatives indeed.
Absolutely.
If I look from an academic perspective, we're now the bioscience engineering department, so engineering a bit more like into valorization, but still as the academics are often put to a scale like how many papers do you have? How much have you published? And then it ends all this money and all this research into a paper and then up to the next, maybe into a patent that nobody sees. If you're have a university, they kind of push you a bit so there are some of these funding opportunities that is together with a company where you develop something. And these, I think there need to be more of them where we can meet each other, because sometimes we have something interesting, but there is no company actually having it in their future perspective, and society is really needing it. So we need to pull it all together, these issues. Yeah, go ahead.
And perhaps also just talk into the fact that this is, of course, on the table for both the pharmaceutical package, the Biotech Act, but also the life science strategy, which would also hopefully include thinking about where would the capital come from and how do we think about this as an ecosystem more than just, silos.
Yeah.
So also here we need a holistic approach.
Yes, definitely.
And then there is actually more aspects to that journey. I remember, Sarah, we were talking, you have the research, then you have the clinical applications, you have, the industry, you have the clinics, you have the community. So there is this whole journey and all responsibilities there.
Yeah, I think it actually goes back to what you said. Like you had a personal issue and now you go look it up because you have the educational background to understand maybe papers. And actually, it had to come from your physician to tell you. So there's so much research. And sometimes I'll just even find a paper from the 1940s where they already found something that we're refining. So there's so many gaps in that. So there's so much research, so much things going on. And then to go to industry, there's already this gap of valorization, of connecting with a company, or universities pushing for options, or just everybody needing a win-win, and who is winning in what. So there is not always a good strategy towards that. And then something is at a company, but how is it going to be translated to the clinic? How is the doctor really going to talk about it with their patient and using it, and which product are they going to use, and how do they make the decision? Is it just a recent representative that came by? And even then, society, if I just get like some kind of syrup, but I don't know what, like, is it really that important? Should I really take antibiotics, or should I just take it for a day or for a week? Then they could have massive impact. So then I think that translates back to academia, that we have, as an education institute, the responsibility to educate society, not just students, but also companies. And everybody has a take in this.
I learned just today, because I'm also very engaged in the whole AMR issue, because also you cannot solve that country by country. It has to be a common issue. And I just learned today, which is, I guess, pretty obvious, but I just didn't know it, that women suffer much more from inflammatory...
Antimicrobial resistance,
I think it's about 25%, which makes... Because, it's deadly if you get a bacteria and there's no antibiotic that can kill it. That also then affects women more than men.
Again,
Right?
Yes.
Even for the AMR, they estimated that by 2050, more people will die from antimicrobial resistance than from cancer.
Yeah.
Oh, wow. Okay.
Globally,
That's,
it's quite many.
So
isn't that one of the focuses of the new Center of Excellence?
it is one of our focuses, indeed, antimicrobial resistance, and it goes also into education and into looking for alternatives of antibiotics, such as probiotics, such as prevention. So it's also a lot of people are working on it and trying to understand the mechanisms, but we cannot keep catching up on this microbe. So I am in the microbe world, and they are smart. So they keep mutating into a more dangerous version, and I don't think it's a decent strategy to try to make the next new antibiotic that's going to be more killing, because it kills also the bad ones.
Exactly.
We've all had to take an antibiotic and had diarrhea and all kinds of other things. So it's not the best solution. So I think we need to accept less of side effects and try to focus more on, okay, what are alternatives? Maybe go back in history. What are they doing? Like yogurts and stuff, like learning to buy
Truth in the old applications.
But we should also, I mean, for me, it's, I think, a two-way street. I mean, definitely, yes, also go and see the background, the use of antibiotics in animal production and all this, definitely also an issue. And then I think we do also need to encourage that there should be more, because this is a big problem. It's already a problem in theaters, operating theaters all over Europe, because they have large costs, because they have to make sure that it's very, very, very clean before they start. And if we could change this cost into something more with a larger perspective, I think that would be
There are already some campaigns on antibiotics that's helped, but I think we have to make people more conscious. Even of
and it's just because there's no business case. That's why it doesn't happen.
Because prevention doesn't always, it's hard to calculate prevention. Yes. If we want to make a study, if we have it the same, you can find a lot of numbers on treatment and so, but to prevent something is something in the future and it's hard to grasp.
But although we are evolving more in that direction, which is a good thing.
Yeah.
Antibiotics is one of the focuses of the Center of Excellence, Umami. What are the other focuses?
So our goal is to, based on microbiome modulated and multidisciplinary approach to really achieve health equity. And then we focus on women's health, children's health, and vulnerable groups. So we have a few cases, and then these are just our start cases. So we have antibiotic resistance and remedies, but also with obesity, which is also one of the now key things that everybody's talking about. And then we also have HPV, which is a viral which can induce uterus cancer. And actually, there is nothing for HPV. So if you have an HPV infection and you go to a gynecologist, say like, you have HPV and that's it. You have to wait till maybe your body and your immune system clears it. And you have to wait a few months and then you come back for a check. And if it's not, which happens in about 90%, but then there's 10% that doesn't, then it's already so far along that they already have to maybe undergo a treatment or an operation. So so for us, we know that it's a virus and it interacts with microbes, and the bacteria in the vagina can really stimulate your immune system to improve, actually to faster clear HPV. So that's one of the cases. We try to focus on there's a lot of cases I think are like hot, but there's also cases that are equally important, and menopause is also one of them, that need research, and they're affecting a lot of people. So those are the starting cases of the center.
They need to be talked about so that they can become relevant. I've heard that everybody here said it, we need to be more vocal about it. It needs to be talked about, to be high on the agenda, awareness or educating. And there is research that's educating it. But then what I also find interesting is, Isabelle, that when you bring a new drug to the market, you have to also go, for example, endometriosis. You have to go and educate, whether it's GPs, whether it's the people themselves, the patients themselves. So you have an educating role there as well to play.
Yes, that's very important. Yes, of course, we have to educate on the product, but also on the disease. And towards patients, it's purely disease because there's a legislation, which is good, that you cannot talk products. It's good because it would be biased, of course. But there's a huge role there, to make people conscious. And I think that patient organizations, for instance, play also a very important role there. If they're well organized, they can do fantastic work.
So would you say that when it comes to awareness, of course, when it comes to the private sector, it can seem more commercial or whatever, the awareness aspect, is it more that the public sector has that role, you would say?
I think we have a joint role once again. Because the specificities of the product are, of course, we know them better than anyone else. So we should be able to explain at least how it works and what the pros and cons are. But the public sector, for me, is having a huge role in awareness on the disease. Yeah. Absolutely.
I think it's important, because you have as well, the awareness aspect. There is a lot happening. We hope to see more research. We hope to see the right policies. We hope to see the private sector investing it. And then we have to educate the public. So I think there are a lot about awareness, and then having these kind of projects to actually educate the public to be more vocal about it. If we would be able to look 5 to 10 years ahead, what is it that we hope, the shifts that we are hoping to see?
I think for me, because I'm in the early stages, in 5 to 10 years, I would like to see the treatment coming out of the research, or the diagnostic approaches, or the preventive measures. One of those three, if I just see something that makes it out of the lab and into the field, into society, I would be really happy.
I would love to see that in the research area, that it is more than normal. It's standard that you can only have real research if you have a gender-balanced approach for I would say any kind of disease. And then, of course, a lot more research. I mean, it's 4% or something like that at the moment, right? If I remember the figure correctly. It has to be a lot more research into the different kind of illnesses and diseases that would only affect women.
What innovations are you hoping to see maybe in the private sector or in your own company? What could you do more in 5 to 10 years?
Well, I think that one of innovations, it's a process. So yes, we're still investing in women's health, you know. So some things will come out for sure. We're investing in menopause. We're further investing in endometriosis and uterine fibroids, etc. Some innovation will come out of it. I'm sure of that. Too early to say which ones, but I'm sure it will come. I think that for now, if we look at the short term, for me, it would be extremely good if we could have an earlier diagnosis for many women. So that would mean that they are heard, that they are taken seriously, and that the awareness has worked.
Yeah,
would be a great outcome, I think.
Let's hope
at
so.
the short term. Yes.
Let's hope so. I think we've made it clear that women's health is not just a women's issue. It's a societal, economical, political issue that requires cross-sector collaboration to bring some change that we are hoping to see as well. So you have research and policy that still are playing catch-up, but we are going into the right direction. There is more talked about. A shift is happening. And I think what we've also discussed is that inclusion aspect, including women into different research, clinical trials, but not forgetting that it's not just, women as gender, but the intersectionality aspect of that as well, because we've discussed that the layers of society or socioeconomic background has a huge effect there as well. And then the shared responsibility is what we've discussed. I think that it's not just your job, or yours, but how can we as partners in this story make some change or drive some real change? That were my takeaways. But what's the biggest takeaway you hope listeners take away? You're saying, what would you say if that's what you've listened to this podcast? I hope you remember that. Oh, you're looking at me? Anybody. What have you learned that you will be like, don't forget?
Don't forget to be vocal.
No, I'm on that. Exactly.
I'm gonna
start talking about it. Start writing about it on your social media.
Don't be ashamed. No. Don't be reluctant.
It all starts with the conversation.
Yes. Yeah. Put the fish on the table.
Yeah. And that will change the world.
Yes, we have big hopes, big dreams, and we are very positive as well. Thank you, Elle. Thank you, Isabelle, Stine, and Sarah, for sharing your expertise, for uncovering this the path to better women's health with me. I hope that the listeners also learned something, but I'm definitely sure they did. And if they want to hear more about this, they could subscribe to our podcast, because there is more to come in each episode. Together, we can actually unravel the truth or uncover the path. And I hope we can achieve that together.
Thank you.
Thank you very much. Thank you.